There's a demand for patients to be able to have multifocal lens implantation when they come along with cataract, when they previously had LASIK. These are motivated people. These patients first came to have LASIK because they desire spectacle independence. So when they get a cataract and they have their cataract surgery, they're highly motivated not to be dependent upon reading glasses, so we're motivated to find a way to give them multifocal lens implantation. But the limitation of that in the past has been the quality of vision. And with different kinds of multifocals, for example, diffractive multifocals, in patients who've previously had LASIK, you can sometimes get into trouble with poor quality of vision. And it's really the advent of newer styles of lenses. In this particular study, we looked at the asymmetric refractive lens, the oculentis lens, which really gives a better quality of vision for these patients. Yeah, well, patients who've had LASIK, they are motivated to not need glasses. So for most patients who've had LASIK, they want to have, if possible, vision for everything without glasses. And I mean, there are many patients where we've used the oculentis implant after cataract surgery when they've previously had LASIK, where they just achieve functional vision. So they're able to function at least 90% of the time without requiring glasses. One of the goals in my study was really to work out what are the things we should look for. How can we decide which patients are best to have this and which patients should we really avoid? And that's been difficult to work out what testing to do. Now I'd say the most important parameter I would look at is the corneal irregularity metric, the CIM. If that's elevated, then I'd be hesitant to use a multifocal lens because the cornea is so irregular, they're likely to be dissatisfied with their quality of vision. Well, in patients who've had hyperopic LASIK, it's important not to make the cornea too steep, for sure, because a tear film can become unstable. In terms of using multifocal lens implantation in patients who've previously had hyperopic LASIK, we certainly have to look at the regularity of the cornea and think about and be mindful of spherical aberration, because patients who have hyperopic LASIK end up with negative spherical aberration in the cornea as compared with patients who had myopic LASIK.